Hey everyone, welcome to Let's Talk About the POTS Life, your go-to podcast for all things POTS. Whether you're living with POTS or supporting someone who is, this is the place for you.
Welcome back to another episode of Let's Talk About the POTS Life. Today we have a special guest with us. We have Dr. Poorvi Desai.
Yes, we're so glad to have you. Thanks for joining us.
Thank you so much for having me. I'm excited to be here.
I feel like we always make these connections sometimes on social media, but I think I have seen something on Instagram that you posted, and I'm always so intrigued, not only just a POTS patient, but then being in the medical field, because I think it's like a twofold in terms of just experience and maybe things that challenges you had, and then how you treat differently with POTS. So we'll dive into all the things, but we are so happy to have you with us. And why don't you kind of just introduce yourself and let everybody know your background with POTS, how that all started?
Yeah, sure. So I am a hematologist oncologist currently. Most of my life was spent in Florida. I grew up in like the Tampa Bay area and I'm sort of back there now again. But I grew up in a family that was surrounded by doctors. Like my mom is also an oncologist. My sister ended up becoming a pediatric hematologist oncologist. And I just had a lot of influence of medicine in general, just growing up. And that kind of led me down a very expedited pathway. I ended up going to a 6-year medical program where I did a bachelor and an MD combined in 6 years after med school. So
Good for you.
it was very expedited. By the time I graduated med school, I was only like 23, and I ended up coming back to Tampa for my residency and stayed here for my fellowship. So I kind of became a doctor in a very like unconventional way. But I think that a lot of me going through it happened before I kind of hit a wall when it came to my POTS and EDS and whatnot, and really allowed me to kind of do things at a younger age, which was in my journey, my ability to get to that level. I don't know how much I would have been able to do if I, was a
Right.
little bit older. So I try to put some meaning into that. But essentially, I have the hypermobile subtype of Ehlers-Danlos Syndrome, and then everything that comes along with that, whether it is POTS, which I think is probably the worst of all of that, MCAS, and last year I also had to have surgery for MALS, Median Arcuate Ligament Syndrome. So the vascular compression got thrown into the mix there too, and a lot of this is kind of like interconnected, and I am figuring it out as a doctor myself. And as I'm navigating my own journey, I'm starting to understand and recognize how common this is for everybody else. And
Right.
I am starting to become more comfortable treating patients as well. So I feel in some ways, this kind of sucks, of course, because it's hard to live with this condition and all of these conditions. But in some ways that I'm able to take what I have learned for myself and apply it in a way. And so, yeah, I'm just like grateful that you guys have, found me on social media where
Yeah.
I've been trying to share more about my personal journey and more educational content recently. So I'm just, I'm glad that like I'm making these connections and I can do my part in trying to figure out how I can help with my medical knowledge and my personal experience. So that's kind of where I'm at now.
It's so true because everything you're saying, all those different diagnoses, like you said, run together. So not uncommon to see. And it's like, sometimes we say like a bingo card, like check, check. You have so many of them. I think something that's interesting because I know about it, but we haven't talked about it on here, having the diagnosis of MALS. Like that's a whole nother thing that complicates people's journey that probably a lot should be diagnosed with, but don't even know how to kind of find the right physicians and advocate for themselves in that way. So I think that's like a whole nother piece. But were these symptoms starting prior to, your accelerated program? Did it come after? Or what kind of started to tip you off that you were like, wait, something's not right?
Yeah, I think that I always had some form of POTS or dysautonomia
Mm-hmm.
since
Mm-hmm.
I was a kid. Like, I remember there were days where, like, I just could not wake up in the morning.
Mm-hmm.
Like, I would have slow gut transit. I would just, like, not wanna go to school. I'd get headaches. Like, there was just a lot when I was younger, but I learned how to adapt, and I learned that I was a night owl, which I now know, as we all know, we have these
Right, because as you start to feel better through the day, I had somebody say to me, she's like, I don't even want to go to bed because I know when I wake up, I have to start this all over. So I'm like, if I ride it out, I'm like, oh, I get it, but I don't think that's good either.
Yeah, no, I definitely adapted to how I operated, and because I was in such a high pressure environment kind of growing up, and there was a lot like I was, in the IB program, I went to gifted classes, like there was just so much competition, and I knew that I was smart. I just knew that like I was on a different timeline than everyone else, and that would be like my circadian rhythm was just different. So
Yeah.
I ended up as like, as school got harder and harder, I was just like skipping a lot of school. And so I would just like study in my bed with my legs, like elevated and I just
Red
like
flag
tried
for sure.
oh I tried really hard to be on like a desk, but like my entire schooling, like I just couldn't do it. And even when I went to like med school and we had all these lectures on like sleep hygiene and bed hygiene, I'm like, well, if I didn't just spend like the majority of my time in my bed or my couch, like I don't think I would be able to make it through med school. And so I think a lot of the the fatigue that I had and all of that when I was younger, I was able to sort of sleep it off, and then I had like restorative sleep,
Mhm.
at that point. And then as I progressed, like I remember I got really into like running and just trying to be like more athletic as time went on, and that's when I really started having a lot more back pain. And at one point when I was in med school, I just started developing a lot more just focal back pain. And I remember getting x-rays and things. And that's when we found out that I had a spondylolisthesis.
Mhm.
And so I have an L5S1. And years later, I found out that I was born with that. Like I had a
Oh.
bilateral birth
Mhm.
defect, which again goes along with all this whole like connective tissue problem and
Right.
whatnot. And so, about I think I was about like 18 or 19 years old when I figured this out. And I was actually just about getting ready to go to med school. But I didn't really have many symptoms at the time. And my surgeons that I saw were like, well, here's a book on back exercises. So go do that. Like,
Good
no
luck.
referral for PT, like nothing other than, oh, you're not like having any neurologic symptoms. So just like you're
Mhm.
on your own, kid. And so then I would just start to think when I would get like the POTS type symptoms that like I was reaching a limit with my spondy. And I would think, oh,
Mm.
my back is starting to ache. I'm starting to like shift from one hip to another. Like it's just time for me to like go home and shut down. And I was able to get through the majority of my medical training that way. Just with like the anticipation of like, okay, I just have to make it to this golden weekend.
You're
I just
right.
have to make it to this one particular day off so that I can just like spend my entire day in bed,
Yep.
or weekend if I needed that. And then you get up and you do it all over again.
Mhm.
Um, and so I was 23, 24 when I entered my residency. And I would say that started to become obviously very difficult for me to like get up super early in the morning and then just be working and on my feet all day. But you still in residency have certain times off where you are protected. You still have some golden, weekends, and you have days where you can just shut your pager off or
Mhm.
whatnot. And so it's like you're running on adrenaline and you're
For
just running
sure.
on a
You
lot.
were running on adrenaline from a POTS perspective. Med school, grads, anybody that
Yeah.
doesn't even have POTS, you're running on adrenaline anyways, but like you have all these ways to run on adrenaline.
Oh my gosh, it's insane. It's like everybody's tired. So there's like
Mhm.
what is the threshold to give you a
What's
break?
normal tired, right? How do you even know?
You don't. There's no way. And then if you try to talk to someone about being tired, like they just kind of laugh at you because they're like, well,
Right.
yeah, you're doing 30-hour calls. Like, what do you expect? Of course
Yeah,
you're
right.
tired.
This is normal for you. It's like what to expect, right?
But I always knew that like something was going on. Like I would
Mhm.
literally do like a 16 to 30-hour shift and then like my foot would drag or I would
Oh my
trip over
gosh.
myself or I would get clumsy. And And again, like it is shown over and over again that sleep deprivation does this to you. So I just kind of chalked it up to that. And like everybody else, probably deals with the same thing. I thought chronic pain was normal. If you're working that
Right.
much on your feet all day, like, of course, that's going to happen. And I would always feel better after I slept. And I would get up and I would be like, oh, let's go. I'm ready to like study all day or, you know, whatever I needed to get done. Like I didn't feel debilitated at all, like throughout. Well, I did, but I didn't feel like I couldn't just sleep it
Yeah.
off and get better.
Right. In your head, you had a reason for it because everyone else was doing same thing, similarly tired, but like I can only imagine yours was like so exaggerated, but you only knew that as normal. So how would you know otherwise?
Right.
No, and I kept on waiting to become like a fellow or an attending because I'm like,
And
oh,
it would all no.
yeah, I'm going to have so much more control over my time. I'm going to just, everything can be so much better. But like there was one particular day in my fellowship where, or no, it was maybe my residency. I was about to turn the corner and somebody had put like water on the floor and not cleaned it up. And I slipped and I fell. And they caught it on camera and they literally forced me to come off of service because they said that was a really bad fall. You need to go to like occupational therapy.
Like
And
something
like
needs done.
here I am thinking like, oh my gosh, like my superiors are like sick pulled this day, like my intern is off, like how I have to run this service. Like I was so hesitant. But that was really the catalyst because that's when we saw that my spondy had gotten worse and it was really like not looking good. And, along with the spondy, my hips were not leveled and I had a scoliosis. And
Jeez.
I like look at this and I'm just like, oh, that was like my aha moment of like, okay, I can't ignore this anymore. Like this is
Something's going on.
something's happening and I really need to figure out how to navigate this now on top of it was like right when I was getting out of residency and into fellowship. And I'm like, I can't push back my medical training because that pushes back my ability to take my boards, which pushes back my ability to graduate. And like at that point, like I had been so go, go, go. And like if I had the mentality that I have now, I would have been like, okay, we're just going to take a gap year and we're going to just try to, do this again in a year. But I didn't have that thought process. And so I was trying to juggle both during my fellowship. And it was very scary because I would go to these surgeons and they would look at my foot drop and they would say, you need to have surgery right now or you're going to be paralyzed for the rest of your life.
By the time that foot is dropping, like that's a big sign.
Huge. And so, but then I was like, but why do I feel so much better? I'm not as dizzy when I sleep, and I kind of just chalked it up to my spondy being mobile. And so when I sleep, it's kind of coming back into place, into alignment. And like, I kept telling myself like these POTS symptoms that I was having, like wouldn't happen if I could just realign my spondy without surgery. And like, now I know about what POTS actually is. I kind of understand that it happens to people who have spondies or they don't have spondies.
And type A, I would add type A personalities like us. So but like it's almost textbook. I hate to say it, but like not that that's everybody and it's not, but it is a lot of high striving type A personalities. You see things like this.
That is actually like POTS is a disease of active young women for the most part.
Right.
I mean, of course, it can happen to non-active people. It can happen to men. But so far as the data that we know is active young women, it's a derailing condition. And there are signs and symptoms from a younger age, but like something can happen, and it can kind of tip you over. But I think I was so stubborn at the time when I met with all these surgeons and I had an understanding of my biomechanics in a way that I was like, well, I think I just need to like strengthen around all of this. And like, I saw so many different surgeons and finally one neurosurgeon's like, why don't you just go to physical therapy and like work on your paraspinal muscles? Like you can just see if like, if that does anything, we don't have to.
If it changes, to avoid that at all costs, You're young. I mean,
to get a fusion at 26 years old.
That would be terrible.
I am so, so glad that like I had an intuition that was like, please don't do this. And I was also like scared from like the things that I would see in residency, like people who came in with
Yes.
rods that were getting infected and like in
Right,
and
and
out
you're
of.
so young, so, like, what's the alternative, you know, like, or long term, not even alternative, but, like, what's the long-term goal of what's my life look like after that?
Right. And then I kept getting all these like misdiagnoses, like I went through one round of PT and they really only focused on my spondy. And of course I still had the POTS symptoms. I still had the
Mhm.
pain in other areas, but how do you kind of go to PT where everything is coded individually
Mhm.
and you're like, well,
Right.
like where does it hurt everywhere? It's not just
Yeah.
my back.
Do you have a code for that?
And I very quickly learned that this was gonna be, like, something that, like, wasn't just gonna be fixed by doing, like, the MedX machine where they literally
Mhm.
only do your paraspinals, and
Mhm.
so I went through a round of that, and I was having a lot of groin pain,
Mhm.
and, like, as a doctor, I have so much access to other doctors,
Mhm.
and there is so much, like, about not wanting to get diagnoses in your chart and how it might
Mhm.
affect your ability to get a job in the future or land a fellowship or whatever it might be. Like, you just don't want to be like, there is unfortunately
Labeled
a huge
or,
stigma.
yeah, stigma, yeah.
And if I didn't know what was going on and I could kind of piece my way through my life, like, I was kind of going to like people's houses trying to figure out like what was going on with me.
Right.
And that's finally when like one of my PM&R like friends basically had told me, I can't really feel your femoral pulse very well. Like you're like, your pelvis is really tilted and
Mhm.
this is probably a compensation from your spondy. And so like I think that you really need to just do a whole body strengthening, like something. You need to like
Mhm.
figure out how you're going to do all this. And luckily by that time I was in fellowship and my fellowship was very research focused. So I didn't have as much clinical duties. Like I
Mhm.
still had some 24-hour calls pretty frequently, but they were from home. And so I didn't have to go in too much. And then
And
I
be
was
on
only
your feet
working.
as much.
Yeah. And then by the time so with the groin pain, then I went to an OB and then she's like, without doing any kind of, surgeries, she was like, you have endometriosis. And I was like, okay, but, like, as a doctor now, I kind of know that you have to, like, see those endo deposits. You can't just do, like, a speculum
Right,
exam and tell
until
me
you
I
get in there, right.
but, like, I had such a tight pelvic floor. She's like, "I've never seen this in anyone who doesn't have it."
Mhm.
So then, the whole, like, spondy thing was kind of taken care of because I was starting to regain function with PT, and now I have this whole thing of, like, "Oh, no, you may have endo." And so I go through a surgery. I'm like 26. I'm juggling residency. I'm like
Oh
trying to
my
figure out what's
gosh.
happening. And I go through this surgery and they're like, well, good news, you don't have endo. And I'm like, okay,
After
but
the
then like
surgery?
after my surgery. So like I know that endo is definitely something that is an association with these conditions as well, but I did
Mhm.
not have a single endo deposit and so I'm like, what is causing all of this tightness? Is it all
Yeah.
musculoskeletal or what's going on?
The
And I'm
amount of people that I see with tight pelvic floor and POTS, I can't even tell you
Yeah.
figure you're tense, you're running on adrenaline. They say, the holistic side would say your pelvic floor is your second brain. Well, obviously we're wired tight up above. So how would we not be wired tight in our pelvis?
every diaphragm that we have in our body,
Yeah.
I feel is just tight.
Tight. Yeah.
And
Yes.
especially when it's around the hip and the pelvis,
Mhm.
that is
So
such a
much.
central area. Like if that even microscopically changes, it's affecting your neck. It's affecting your toes.
Everything.
Like,
Yep.
um, But I realized on that I looked at my pathology and my op report, and they were like, "Your uterine ligaments are extremely lax." And
Yeah.
I saw pictures of it, and it looked like Play-Doh, and I'm like,
Oh my goodness.
"What is causing that?" Like, I don't
Yeah.
understand, like, how is it everything so tight?
You're
But, like,
so young.
I'm so young. I have not had any children. I am, like, not even really sexually active because I can't like, the pelvic floor is so tight at that point,
Right.
like
And
and
you're working, like, all the time. That's yeah.
Yes.
all day, like, it's cruel. I would literally was like, I don't know what's going on, but I need to figure this out. Um, so then I asked my surgeon, and he literally just shrugged. He was just like, well, my job was to figure out if you had endo or not, and you don't.
Nothing beyond that.
And I was like, okay, so I've gotten a book on back pain from a surgeon. I've gotten a shrug from like another, and I'm
Inflated ligaments.
I'm like, I don't know what's going on. So then I kind of started looking into like the idea of like this pelvic tilt, and I realized like that is exactly what I have. And so as I started my fellowship, I just really went hard on PT for the second time. And that's really what changed my life, because the physical therapist that I had was the one who diagnosed me with hypermobility, and really started to work with me on like full body strength and conditioning.
Full body.
And
It's
she,
so important.
oh my gosh, it was excellent. Like, she was such a good neuro rehab specialist and just understood like a lot about that. And then lo and behold, the next year, COVID hit. And when COVID hit, I was in my second year of fellowship. I was still going to PT pretty religiously when I could. But that was the first time that like everything went virtual as much as it could. And I wasn't on my feet all the time. And that's when I realized how much more I was progressing in PT because I wasn't on my feet all the time. I was actually like, I had better days because I was like more cognizant. I was more aware. I didn't have to like take a nap every time I got home. And I
Yeah.
just felt so much better with that. And my PT found Pilates at that time. And we started coupling Pilates with manual physical therapy, with strength and conditioning. And like, I felt like I had struck gold when it came to neuro rehab at that time.
Yeah.
And so again, I didn't understand that I had EDS at the time or POTS, but as I started like doing more research into all of this, eventually I realized that I did have the full syndrome, or at least I suspected it. And I wasn't tracking my heart rate at the time. I didn't actually understand what was going on, but I thought I had everything under control. Then that's when I graduated. So I graduated my fellowship and I went straight into working as an attending. And I knew at the time was that I couldn't work 5 days a week. Like, I just kind of knew it. And I unfortunately landed up in a private practice situation, and I just couldn't compensate anymore. I was, I had taken my board exams, and hematology and oncology boards are two separate exams. They're literally back-to-back days, 8-hour plus exams.
Oh my
I'm like
goodness.
laying down on the floor in the middle, like
Oh
on
gosh.
5-minute breaks, just trying to circulate my body, becoming so deconditioned over like the course of a
Wow.
couple of months leading up to it, because all I'm doing is studying and writing, and I have tendinitis, and I'm like losing all of that progress that I had made. And I can just feel so much pain, and I'm so tight and I'm so weak that I think, all right, this is going to take a long time to recover when I'm done with my board exams. But unfortunately, in that practice, during that period of time where COVID was still sort of lingering, and there was a lot of like people quitting and things, like the problem became I was expected to pick up the slack. And
Yeah.
unfortunately, when that happens, and this is, I think, what healthcare does, is it puts all the burden on your shoulders, as if you are as an individual responsible for all the failings of the system.
Yeah.
And it was right around the time where I was starting like therapy, like counseling, just, because I knew that I had been through a lot and I was going to need it. And
Right.
now I could finally
Pain's
afford
still
it.
going through a lot. Right.
hmm And I hadn't really sorted out boundaries yet. I didn't actually understand like all of these unrealistic expectations that people are put through, especially first and foremost being a woman of color,
Healthcare.
being a healthcare professional.
Yeah.
It was just like, I couldn't believe, like, I had thought so much that I was going to have so much more control over my time, so much more autonomy.
Right. You were
I
waiting for that. Like, you were striving to get there.
And then I finally get there, and like, is the money good? Yeah, but my time is not my own. I can't compensate. I am literally getting to the point where like, I don't know, I just can't breathe at the end of my day. And
plus,
I
you still don't even, at that point, you knew a little bit what was wrong, but you're still having extra symptoms, regular life, burdens, and nothing is what you thought it was going to be.
No, and it got so overwhelming that I remember the worst part, I think, and there's this talk about the trigger, right? Like for a lot of people, that trigger is an infection. COVID has really, unmasked a lot of people who have hypermobility. It caused POTS with long COVID and the post-exertional malaise and all of the things that come with that. And I, I don't think that I had COVID, like the actual virus by that point. But I definitely got to a point where I think I was work was getting completely unrealistic in terms of what I was expected to do. But I think the worst is that I leaned on people, I would say my own family, and that was just like a big betrayal to me because they shamed me for the things that I was going through. It was like, "Oh, you can't work 5 days a week? Like, you're literally out
Why
of
not?
Yeah, like, you're out of fellowship less than a year, like, what's wrong with you? Like, why are you being so lazy? What" and I'm like, "I'm literally just asking to go to, like, maybe 3 days a week. I'm not even asking to just, like, completely come off."
And it's to survive, not because you're lazy, not because it's because you can't.
Yeah, you'd been pouring from a cup that was empty for so long, and that you just needed a little bit of time to fill your cup back up, honestly.
And I knew, I was like, if I just had the time to do that, I would be better because that's how I was getting through the past couple of years. Like, I was juggling all this, but I was able to do my job well and, be able to go to PT religiously and, my doctor's appointments and make sure that I'm like pacing myself through my day. And then suddenly I wasn't pacing anymore. I was like literally on from like 6 o'clock in the morning till I was finishing my notes by like 10, 11 p.m. I'm like, this is not sustainable, especially in a body like mine. Like if you are, you have a spondy, you're constantly feeling that nerve compression. You're constantly feeling just like that adjustment issue in your hips. And then on top of that, everything with the joint hypermobility. And I didn't have the time to do my exercises and then recover from all of that too. And I remember like one day particularly, I was just like, I am so overwhelmed and I was just getting like yelled at, like, why are you like this? Why can't you do this? Like the obligations of like networking as well or whatever it might be. And I had a really hard time saying no. And I just thought like, I'll just push myself and I'll keep doing things. And then I remember when I was getting like basically yelled at, I literally felt in my stomach like some kind of a electric shock. It was very strange. It just felt like something was just squeezing me. And now I know that to be probably a mast cell reaction to like emotional stress because I was like, how do I explain that like I've only been able to be this successful and this good because I've paced myself as best as I can.
Right.
And now
Which is that's a hard thing to do, especially when you quote unquote look fine and you're young and you made it through, you obviously brilliant, making it through school. You're all these things. And they're like, well, why can't you now? I think that's even harder to advocate for yourself, to tell people like, no, I really am struggling, or have people believe it, which is so sad.
Yeah, it was the hardest, most emotional, I think, just like it was a lot of what I now can label as like emotional abuse, I guess. And it was a lot of being dismissed and not taken seriously. And it really spiraled out of control to where I had to do a lot of therapy to try and figure out my relationship with my family. When you're Indian, a lot of the love is based on achievement and there's a lot of conditional kind of things. And it becomes very difficult when you suddenly, especially as a woman, just like can't do things.
Yeah, you can't.
You are just expected to cater. You are expected to put yourself last. And it becomes a very foreign concept to even give yourself 1 day a week at the gym is like a lot. A lot of women can't even go and get their nails done because they think that they're doing something selfish.
They're taking time away from their other responsibilities that they should be doing instead of looking at it as some self-care for yourself.
That's needed.
Yeah. And this is coming from people who are in the medical field and they still can't understand that this is medicine for me. Like resting, pacing, taking care of myself, this is medicine. And I was also going through a lot of like reflections in therapy, which let me tell you, therapy is great, but it's hard in the beginning. You have to face your demons.
And pull all those back and really expose all the things you've been burying, hiding, protecting the whole time.
Yeah, being vulnerable.
Yeah.
And you have to be radically honest with yourself and kind of, you can't, like, you have to get through it. And I realized I had no sense of boundaries. I had no sense of saying no. Like, I didn't know how to stick up for myself. But I also learned that I was not helpless at the time and that I could get out of this situation. And I realized kind of, this is so much of an invisible illness. And so if I don't show people what I'm going through, if I'm not communicating, then part of that's on me. Like that also, like, I have to understand what I'm going through enough to where I can then kind of tell people like, this is what I'm going through. And then what they do with that information is on them.
Yeah, you can't control how someone receives that information or the feedback or what they do with it. All you can do is try to educate and share from your perspective and hope that it lands on ears that are willing to hear it.
Yeah, right.
And I was also at a point where I was learning how I wanted to be treated in terms of learning. So when I went through, physical therapy, it really was the first safe space that I ever had in a learning environment, or so I perceived. And it really felt like my PT was just so like, she was just celebrating really what I thought to be small wins, but were actually very big. Like, hey, you had this like foot drop when you're really tired and now your toe is really strong and you don't have to have surgery anymore. Like, that is a huge thing. But as I was getting coached, through it, these little tiny wins throughout like my life, which I wasn't open about because all I was doing was going to PT. Only really my PT knew, and maybe a few close people to me. But that day-to-day kind of positive reinforcement that I started getting, I was like, wait, I've spent my entire life in like a fear-based learning environment. A lot of the way that I was, raised was critical, and that kind of just like never really stopped. Like the criticizing is just, it's just like a normal way that Indian people like to raise their kids. I don't know why, but maybe, it is. Medicine is a very critical environment. Like, you are constantly having to put your best foot forward, and you're evaluated in ways, and people are tired and judgmental. And, I don't want to say that all of my medical training was bad, because I had a lovely time in many ways, and I learned a lot. But there is a hierarchy. There is definitely rules that need to be followed. And if you show weakness, if you show that you may have POTS or EDS, you don't know how that's going to be perceived.
Right. And you're trying to figure things out on the fly and feeling all these things and dealing with PT and the spondy and, such a mixed bag. I mean, it was a lot to take in all at once.
But I kept thinking, I'll get through it. Just get to the other side, get to the other side. And then something happened where I think the verbal kind of bashing against the way that I was feeling, and the criticizing and the gaslighting and all of that kind of just compounded. And I was just like, okay, well, this isn't really helping me. This whole like not talking about it thing is not really my way.
So now I need to share.
I need to find my community. I need to actually get like a real diagnosis here. So I waited a year to get in with MUSC and the Mayo Clinic. And so and in that whole year, that's when the malice really set in. Like, since that really squeezy sensation that I had, that never let up. And I ended up losing something like 20 pounds in 6 weeks.
Oh, wow.
I was wasting away. And I was registering the people around me kind of they were kind of like, oh, how are you losing this weight? Like, this was pre-Ozempic era, right? Like,
Right.
they were not like, oh my gosh, Poorvi, like, this is concerning. And
They're like,
I'm
how'd you
sitting
do
here
it?
like, I'm going to need a feeding tube. I'm going to have to go to the hospital. Like, and I was, again,
Yeah.
stubborn, me. I'm not doing that. I don't want to go to the hospital. I spend enough time there anyway. And I was like, what do I do? So I was eating Chobani for 6 weeks, literally just like drinking liquid protein as much as I could. And it was
Who eventually, was it Mayo or who figured out the MALS piece of it?
well, that was a whole thing. I've basically diagnosed myself with everything that I've been through, and then I've had it confirmed.
Right.
So I basically went to the neurosurgeon at MUSC, Dr. Sunil Patel, who's just great. And he literally just like twisted my arm and he was like, yes, you have EDS.
Yes.
And I'm not going to operate on you because you've been so diligent about your exercising and all of these.
Right. And rehab. Right.
You just have to do that. But let me tell you what, you need to quit your job. You need to stop this because you were so good when you were pacing and everything. So, and he's Indian. He's the same type of Indian I am. And he's sitting there talking to me in Gujarati, which is our shared language. And half my conversation, literally, he just twisted my arm and he's like, yeah, you have hypermobile EDS. The rest of that entire consult that I waited a year for was a pep talk for me to get my life together and me.
Yes.
And so I was, okay, that's strange. And then a month later, it was the EDS clinic in Mayo Jacksonville. And I was under Dr. Dacre Knight, who, gosh, God bless, he's at UVA now. And I just, he really, him and Shilpa, they both, Shilpa is his PA. They both kind of just diagnosed me. They took me through the whole Beighton score, and then they like mass triaged me out to like a hypermobile specific pelvic floor therapist. Who told me all about wearing compression. And then I saw an occupational therapist who, you know, really told me about like the red light, yellow light, green light, like, and I'm thinking, I've never been exposed to something like this throughout my, you know, years of medical training.
Right. Isn't that sad that this is such a giant piece that's missing?
Gigantic. And that's really when I started understanding that like I'm a doctor well equipped for acute care. And so are most of the doctors in this country. Most of our training was done in the inpatient setting. And, you know, but the majority of people need to be treated outpatient and have long enough appointments to be able to understand what's going on with them. And we have to figure out longevity in terms of chronic illnesses and not just wait for someone to develop MALS, you know, to be like, oh, shit, something's happened.
Right. No, it totally makes sense. And I think now you probably, like you said in the beginning, I think you said it like maybe one of the first things you said was now, like, look how equipped you are. You're looking at medicine and your patients from a whole different lens that blessing and a curse, right? A curse that you had to go through all these things, a blessing for your patients that, you know, you are looking at the whole picture in so many ways.
So many, and it's forced me to learn so much more than just my training. Like, of course, I'm very happy that I know how to use biologics and I understand the immune system and DNA and all of these things. But then there's that whole component of biomechanics that I didn't really understand before. And now I'm suddenly having to like see all these GI doctors. And unfortunately, when I went to Mayo Clinic, it was great. Like, they diagnosed me officially. They were really encouraging me to take a step back from my work. And they had even written me like a medical leave kind of form and everything. And it was really becoming unsustainable. And they made me realize like, no, really, like this is so much more than what you can do on your own. You need external support. You need to slow down.
You need help, right?
So then I was like, okay, well, this stomach thing is still not solved. And I went through like an EGD. I went through a barium swallow. I went through everything. Everything was negative. But I knew that I was having symptoms of ischemia, like visceral pain. It was awful. I would say that MALS was probably the worst thing I've ever been through in my life. And after every meal, I'm sitting there just keeled over, like, just it felt like someone was just squeezing my insides.
Oh, yeah.
And I was like, this cannot be normal. So even like the vascular surgeon, we did a CT angiogram and nothing showed up. I did inspiration, expiration protocols. Like, I did all of the right things, because normally what you can see is like that median arcuate ligament, right in that, where your arteries are, your celiac artery and your superior mesenteric artery. You would see it collapsing, and you would see what we call a J hook appearance, where it's nicked. And that is a clear indication that you need to remove the ligament because it's too wobbly and it's falling on the artery and compressing it. And then a surgeon needs to go in and needs to put in like, a stent or something inside of the vessel. But there is so much controversy about what the proper way to go about this is.
Yeah.
And on top of that, I'm having what I think is ischemic symptoms, and I'm having major bloating to the point where my spondy is getting irritated now, because it's just, I look pregnant after I eat, even if it's a little bit, and I'm getting really woozy. Even the anticipation of eating, that's a strange sensation when you are hungry, but then you're so fearful at the same time. It was just bad. So the vascular surgeons, the GI doctors, they kept telling me, there's nothing we see. There's nothing we would operate on. There's nothing we would do. So eventually I went and I ordered my own ultrasound Doppler, because I wanted to see my velocities. And my velocities were sky high, which clearly says that there is a compression. But nobody knew what to do with it. So I lived with that information for a year, and I just kept on eating and pain, nausea, all of these things. And then finally, I went to the EDS Society's meeting for the first time, and they had a physical therapist and I think an OT that were talking about MALS. And I met all of these people around me who had EDS, and they were all like, Poorvi, your symptoms are so much worse than what we would expect in the typical EDS patient. Like, yes, GI symptoms are a part of it, but this is really worse. And so that once I heard the term MALS, and I knew that one of the criteria was the velocity increase, that's when I realized that I had I probably had the neurogenic component of MALS, and it did not show anything on my scans. And so I went through a celiac plexus block, which helped me. I went through, multiple surgeons that I had, consulted with all over the country. And I finally found somebody within just a couple of months. And I was able to get my surgery done where they took out my celiac plexus and they took out my median arcuate ligament. And that was by Dr. Kevin L. Hayek up in Cleveland. And let me tell you, like, he's written a book now with a couple of other surgeons across the country about doing things robotically, minimally invasive, because a lot of surgeons also think that MALS needs to be like an open surgery, and that's
that's what I've heard. That's what I was wondering. Yeah.
No, and it's actually more dangerous for patients with EDS because, you end up having a lot more complications with wound healing, infections, things like that. So I'm lucky enough to have my medicine brain to know what I was willing to tolerate and not.
Yeah, that's so
And I had to do a lot of digging to where then I made that diagnosis of neurogenic MALS, and then I took it to the surgeons, and everybody basically agreed, this is exactly what's going on with you. And after I had my surgery, that was almost exactly a year ago now. I still deal with like these symptoms of POTS and the fatigue and all the post-exertional malaise if I don't pace myself and all of these things, but at least that visceral ischemic pain and like the ability to eat is gone, which I thank God every day. But I remember there's a neurogastroenterologist named Laura Pace, and she had given a lecture on MALS. And one of her concepts is that MALS might be like on the most severe spectrum of POTS. And it might be interconnected in this neuroimmune axis that we are all dealing with when it comes to autonomic dysfunction. And, some of us might need surgery for that. And vascular compressions probably play into POTS and all of these different things that we have going on. But right now, we just don't know too much. But
I hope research, and like you said, post-COVID is going to bring out some of that and pour into that. But like, even at that point, we're still years out from like deep, heavy, concrete, I guess, research, little things. And I hope it just brings, like you said, like more of those pieces to put together, or more awareness, or, just more understanding that it's not just, that POTS monster. There's so many sub lanes that we need to look at. And just because, you have POTS, but like, is there something else interconnected? Is there a vascular component? Is it MALS? Is it, EDS? Is it MCAS? There's just so many things that go to that. So it's not even like, we hope awareness for POTS, but all these other little things that come with, this whole umbrella.
I'm going to take you to giving real quick out of your healthcare space for the folks listening that aren't in healthcare.
Yes.
Can you tell us a little bit more about what MALS is? We've said a lot about the diagnosis, but I don't think we've talked about that yet on this.
No,
so like,
don't know.
Could we talk about what MALS is?
Yes.
Yeah, so it stands for Median Arcuate Ligament Syndrome, and the median arcuate ligament comes off of your thoracic spine, so kind of mid-back, and it wraps around to the front, like where your stomach is, and it kind of goes over your celiac artery and your superior mesenteric artery, which those are two arteries that actually supply your stomach. So like while we all need blood to perfuse all of our organs themselves need their own blood supply too. So basically that ligament is, it's just like present, but when it gets wobbly or when it becomes weaker, or if you have something like me, like a spondylolisthesis, and your back is always arched a little bit and it shoves that anatomy a little bit forward, your diaphragm then starts to hang low. And it can shift the anatomy to where that ligament can then just sort of compress right onto the vasculature. And in my case, I would say that trigger that I had that day that like everything just started squeezing and kind of getting out of control, I think something in that ligament, probably got weaker.
Something.
And that may have been kind of the onset. For some people, it might be, just like, I actually don't 100% understand, like, why do people get, symptomatic at an older age? But it happens. And then when you have these very vague symptoms, like people love to say, you're having anxiety, but what you're really having is bloating because the stomach itself is not getting its own blood supply. And the celiac artery and the superior mesenteric artery both have their own specific syndromes depending on which one is inhibited, but both can coexist as they did in my case. I've heard that with SMA syndrome, that's when you get more of the bloating. You don't necessarily get that with just the celiac artery. You can get pain with that one. But essentially, there's a certain criteria to diagnose it. One, you have to have the anatomy for it, so that low-hanging diaphragm, and potentially seeing it on a scan. Number two, you have to see increased velocities. So basically, one super easy way to do that is if you have difficulty wearing a bra or anything tight in that like upper epigastric area, if you have nausea with like just pressing in that area and it irritates those nerves and it makes you want to throw up, or if you're like working out and you're putting too much like into your core or something, that triggers the pain, the nausea, the just awful feeling that it is.
Wow.
And number three, if you respond to a celiac plexus block, so the celiac plexus is like a nerve bundle that sits right there that is innervating into the stomach and that whole area. And so if you put a lidocaine or some kind of anesthetic into those nerves, it should block those pain signals. And that has been so life-changing for a lot of people who have MALS, especially people who can't go through surgery, like if they have vascular EDS or they just have a very complicated anatomy and they're not able to sustain a surgery. The block can be pretty life-changing. And this block is something I order frequently as an oncologist for my pancreatic cancer patients. So when they have a lot of pain with eating, I didn't even realize like I was experiencing pretty much the same pain as patients who have pancreatic.
Isn't that interesting? Yeah.
And it allows you to eat better. It allows you to like kind of relax a little bit. But, with those three criteria, it can be much more clear it's still very misdiagnosed and it's still
Right.
a lot of gaslighting, even when people have that J hook where that compression is seen on the scan. But now we're learning more about this concept of neurogenic mouths, where you can have met all of those criteria and you still need surgery, even if you don't see it on the scans. And that's exactly what happened to me. And I'm so thankful that, I had a surgeon who was publishing on this, who had a protocol on all of these things. And that I had access to going anywhere in the country with, my health insurance, because a lot of people are very limited based on what
my gosh.
Yeah.
Right. You know what's so cool though? I can't wait to have this podcast come out because I actually have two in mine in office. And I think it's very similar to you. Obviously, POTS, hypermobile, all the things, but she keeps describing the same type of pain. And I knew a little bit about it, but hearing
Your story. Yeah.
I'm like, oh, I cannot wait for her to hear this because exactly where that pain is. And she's like, I could just get it. I can just push on it and it makes everything worse. And she has had many tests that were negative, but I also think she's continuing to test, but I can't wait for her to hear this. I mean, everybody can hear this, but specifically the one in mind, because I just think the more you know, the more pieces you can put together. I mean, we had Dr. Nance on a few episodes ago, and she always says, you have to get all your data points.
Yes.
And the more data points you can get and the more pieces together, I mean, I just think it's amazing. And that's why stories like yours, I mean, obviously, so many different things that went with POTS, but then just how you're sharing it and how you're a physician and I think it just shows people you still have to advocate for yourself, because I know that's a frustration of many, but even in your shoes, you're human. You still have to be standing up for yourself, essentially.
And I think
a lot of people to remind me of that. I needed a lot to tell me, hey, this is fine. You just need to figure it out.
Right.
You're going to get back to doing what you need to do, but you just need to take a step back. And, there's so much more out there also about what is helping people with POTS and whatnot. But I do think that one thing that I really advocate for now is just reducing the stress of the people around you. If they're causing you a lot of pain, if they're causing you a lot of emotional distress, we tend to focus on these triggers that may really worsen things to be more of things that really weren't in our control, like getting a virus or getting in a car accident. But, I think MUSC just came out with the idea of these triggers and what percentage of their database really had it. And I think 14% was emotional stress.
I believe it. That is what gets me now more than anything.
I was actually just gearing up to ask you the question I ask everyone about what's your advice for someone that's newly diagnosed. And I think that maybe is your advice.
Perfect. I mean, it is. Because it's decreasing the triggers that they're not what you think of as typical triggers, but the emotional piece, holy cow. Now that POTS from a global standpoint for me is under control, but I can still feel little, I say hiccups that come with the emotional side of things.
Definitely. I think that as people who have maybe looser connective tissue or our nervous system is already kind of wired in a certain way, taking the self-blame out of that, because this is the best way our bodies know how to compensate. POTS is actually, the tachycardia part of that is actually because your body is trying to compensate for low blood volume.
Right.
And, so then just, help your body as much as it can, whether it's exercise, whether it's electrolytes, anything that you can do to really try to reduce the burden, because you're worth that. You are worth having a body that works the way it's meant to work. And, it's whether that means taking medication to suppress your menstrual cycle or, not kind of throwing yourself into crazy work environments. And, I ended up becoming an independent contractor, and now I take assignments as I need to in a very controlled setting. I don't do any overnight shifts. I don't work weekends. I have my recovery days, and this is the
control to meet your body where it is. And that's okay. That's a good thing. I think if anything, that's the healthy thing, right?
Yeah. And I also feel like I've gone to so many conferences now, and I've heard unfortunately, some doctors who created some protocols and things that are blaming POTS on a lower left ventricular size or, not exercising enough or all these things. And I just want to tell everyone who's listening, like, that is just false. Like, the majority of people who have had these issues were active, very highly educated, just killing it at life. And, a certain trigger sort of, it's just like the threshold in the body to get dysregulated is lower, and it's easier to meet with an infection or whatever it might be. And so if you have something in your control, like the way you cope or the people who you surround yourself by or whatever it might be, like, this becomes a very big lifestyle change for everybody. And
You say that's like our favorite word, a lifestyle change. Like it's, all the time. Like it is. I think that's like the biggest thing that we try to preach through this is like a lifestyle change, 1000%, because it takes a full picture. Yes.
And I think we've been chatting with you for over an hour now. And I think what we might need to do is have you back for a second visit where I'd love to pick your brain a little bit more on another episode about, from the healthcare perspective, about giving more autonomy to our clients that are listening, about how to advocate for yourself in that space. So we'd love to invite you back in a future episode to share a little bit more.
I could talk to you forever.
I know.
You guys have been really wonderful. I'm really glad that, you're putting all this out there. A lot of people are going to be helped if they haven't already, So thank you.
Well, thank you
Thank you so much for joining us.
Yeah, don't forget to subscribe, follow us on all major platforms. You can watch us on YouTube, and please tune in again when we hopefully have you back.
We can't wait for you to hear this episode and our future episodes with her. So we will see you next time. Bye.